Hi, so welcome back to the Practical Guide to Your Gut. This is Module 2, Lesson 2. I've entitled it Lifestyle and Your Gut. And in this lesson, we're going to talk about external things that we do as part of our lifestyle that affects our gut. So I'm going to cover such topics as stress, sleep, and movement of the body and how it affects our gut health. So first we'll talk about stress. Um, the kinds of stress that we put on ourselves include acute stress and chronic stress. Um, Anything such as like feelings of overwhelm or anxiety, feelings of helplessness, uncertainty, lead to despondence and depression. These kinds of reactions that we have to stress caused either externally or internally has an effect on our overall health and particularly our gut health. And stress, as you can see, has uh, been indicted as an underlying cause of many chronic disease conditions. It's been known to affect heart disease, cancer, autoimmune disease, and negative emotional stress can influence our inner dialogue and contributes to chronic stress. So the components to chronic emotional stress are internal and external. And as you can see in this cartoon chart over here, lots of ways that stress affects our body, from our respiratory system, our central nervous system, cardiovascular, digestive, endocrine, musculoskeletal, and reproductive systems. So stress is really something that needs to be dealt with and addressed in our lives, and so many people do not. And when it is not addressed, then it can just be further internalized and cause disease. And the way chronic emotional stress is manifested in our body is that we may feel that we're constantly in a state of fight or flight. This is the brain's sympathetic nervous system responding to stress, right? Fight or flight is a very primitive way of dealing with stress. This is the body's way of dealing with stress, whether it's the stress of being chased by a tiger, or it's the stress of a busy work day and emotional events. The body sees it as no different. So, so it reacts the same. Now, that's our reaction from from our sympathetic nervous system, right? Our sympathetic nervous system counteracts the sympathetic nervous system, and it comes into play when we're feeding or eating, when the sex is taking place, or relaxation. That is when the parasympathetic takes over, right? But the sympathetic nervous system is fight or flight, and this is what contributes to chronic stress and also acute stress disorders such as PTSD. And these conditions increase our risk of autoimmune disease and also leads to unhealthy coping mechanisms, with which further perpetuates the stress. And this is called buffering, which we will talk more about in Module 3. Um, so some of these unhealthy coping mechanisms can be cravings for sugar, carbs, caffeine, nicotine, alcohol, or drugs. And also it manifests itself in behaviors such as overspending, overworking, procrastination, addictions to porn, to maybe over binging Netflix. So these kinds of things are our bodies and our minds' responses to stress. And it's all a way of covering up the stress or putting the stress aside, but you're never dealing with the stress when you are using any of these mechanisms to buffer them away. So we saw some of this in Module 1 when we talked about the brain-gut connection. When we talk about the sympathetic nervous system, which is really in the spinal cord here, and these motor pathways and afferent pathways. This is emphasize the connection between the brain and the gut. The spinal cord is an extension of the brain, but see, you have here, this is the most primitive part of the brain, and this communicates with various positions of the gut. So you can see that there is a distinct connection between the brain and the central nervous system and the gut. And this is a bidirectional communication system, meaning it goes from the brain to the gut and the gut to the brain. And this links the emotional and cognitive centers of the brain with peripheral intestinal functions. So our brain, meaning our thoughts, influence our gut function and vice versa. These are the times when we talk about butterflies in the stomach, or we have nausea with our anxiety. This is all about the gut-brain axis. Serotonin, which is a hormone that is, it's really a neurotransmitter that is implicated in, that's like the feel-good hormone, right? When people are depressed, the serotonin is decreased. Well, 95% of serotonin is produced by the gut, and this affects mood, sleep, digestion, nausea, wound healing, blood clotting, sexual desire, and inflammation of the gut or dysbiosis can cause brain fog and impaired cognitive function. So when you see infections of the GI tract by either H. pylori or any other pathogen, or leaky gut, when those tight junctions are opened up a little bit, this causes brain fog and impaired cognitive function. And you see that there are probiotic bacteria, such as certain lactobacillus species. They also contain the neurotransmitter GABA that can help regulate brain activity and calms anxiety. So again, here's another example of the microbiome itself communicating with the brain. So when you talk more about stress, you not only talk about the stress that our our bodies go through all the time, fight or flight, but we also talk about inflammatory stress. This is another form of chronic stress. The inflammatory stress of our diets that are rich in sugar or flour, in high glycemic carbs, artificial sweeteners, eating food that is nutrient deficient, the fact that we don't move as much, we have a sedentary lifestyle, or we may be obese, and there's also environmental toxins to be considered. So all of these things go to promote inflammatory stress in our body. And further to that, stress can also cause the adrenals to overproduce cortisol, which is the stress hormone, along with norepinephrine and adrenaline. And so when the adrenals are producing these stress hormones, they cause the cytokines, which are pro-inflammatory. That's IL-1, IL-6, and TNF, which is tumor necrosis factor. They are pro-inflammatory. So you have active inflammation going on. You have blood sugar disturbances, impaired cognitive function, and increase in blood pressure. And also, if you have these stress hormones and the adrenals like overacting, overproducing, you can have sleep disturbances. So people may describe that they feel wired but tired, right? Or they have panic attacks, or they crave sweets. They're easily startled by noises, and then they crash in the middle of the afternoon with afternoon fatigue, because cortisol kind of is cyclical, right? So you do get kind of a downturn during the day, but you're supposed to get a spike. It starts by spiking in the morning, and then you go down during the day, but then it kind of goes up a little bit in the afternoon. But when you have chronic stress, um, your adrenals kind of burn out, and you crash, right? And this is from overproduction of cortisol and the stress hormones, right? And when you have this kind of stress, it also leads to overconsumption of alcohol, cravings for sugar or carbs, which leads to a dysglycemia and ultimately to insulin resistance, which can lead to weight gain. So what happens when you have stress hormones, cortisol, norepinephrine, noradrenaline? What happens what happens to the gut when these stress hormones are released? Well, it causes the immune system to release histamine and prostaglandins. So people may look like they have allergies because histamine, remember, is also on the allergic pathway. You also have increased intestinal permeability. Stress hormones also can cause a leaky gut, which is a setup for a major immune dysfunction. Because remember, leaky gut, when those tight junctions open, all those all those particles and pathogens and all kinds of stuff leak out into the bloodstream and cause a systemic inflammation. Stress hormones also cause reduced water, sodium, and calcium absorption, and there's reduced blood flow to the gut. So you're not bringing nutrients and taking care of the gut, right? It also causes symptoms of reflux, dyspepsia, and ulcers. So now when we talk about sleep, sleep is an essential function, right? Adults need 7 to 9 hours of sleep. Why do we need so much sleep? Well, it's because that's when our brain and the rest of our body kind of does the processing of what happened during the day. So the brain will process all the events of the day while we sleep. And if you don't give it enough time to do that, then your brain is not doing its job properly, right? The rest of the time, the rest of the body while you're sleeping is making repairs. And this is a time when you want to be able to be relaxed and allow the body to do its functions, right? And it is recommended that you do not eat 2 to 3 hours before bed. And because this interferes with this repair process that goes on. If your body is focusing on digesting food, it's not going to be doing the repairs that it needs to be doing, right? And also, insulin resistance can be caused by lack of sleep and elevation of the stress hormone, especially cortisol. So we really need our sleep, and I think it's very much underestimated how much sleep we need. Um, so, and I think our overall function is improved the more well rested we are. So, what's the connection between the gut microbiome and sleep? Well, when we talk about the gut microbiome and sleep, we're really talking about the underlying connection, the gut brain axis, right? So, taking care of your gut has great effects on the quality of your sleep. Um, if you have better sleep, you have a healthier microbiome and vice versa. So so people with insomnia or depression um, can some of their answers can be found in their microbiome. So dysbiosis or any of the gut disorders that we've already talked about has an effect on your sleep, may cause insomnia, may cause depression because of an imbalance of serotonin and an imbalance of GABA. which affects the gut-brain axis and the communication between the gut and the brain. So, sleep disturbances can be caused by several different things. One certainly is a constant elevation of the stress hormones, especially cortisol, in cases of adrenal fatigue or burnout. Um, Cortisol is constantly elevated. It's not in that nice cyclical cycle that normally is part of our circadian rhythm. It's constantly being elevated. Uh, so people may report feeling wired but tired. Uh, Living in a constant state of chronic emotional stress, you're constantly being chased by that tiger. You're constantly in a state of fight or flight. This is also a feeling of chronic emotional stress, which can disturb your sleep. Finally, poor nutrition and gut dysbiosis will have effects on your sleep because you have maybe nutritional deficits such as zinc or magnesium, which can affect the sleep. And chronic disease conditions such as heart disease, including congestive heart failure, atherosclerotic heart disease, vascular diseases such as stroke, um, depression, arthritis, kidney disease, and obesity. People who live in chronic pain have very disturbed sleep. So, some of the things you can work with, and some of the things are a little more challenging. If you want better sleep, uh, you need to be mindful about reducing your stress levels. Um, Doing a practice of meditation on a regular basis is very helpful to reduce stress level. Breathing, uh, mindful breathing, movement, body movement, not being sedentary. We'll talk about exercise in a lot of different ways in the next slide and in the next module, but movement, including, being able to get up or doing, you don't even have to do like huge exercise. You can do yoga uh, or mindful stretching, right? And also having a bedtime ritual, maybe journaling a little bit or taking a bath before your bed, um, and just setting the room in a quiet state will help you reduce your stress level and give you better sleep. And then the other thing you can do is don't eat 2 to 3 hours before your bedtime. Because remember, that's when your gut is going to be doing its repairs while you sleep. So you don't want to give it any other jobs to do. Um, and alcohol, sugar, and caffeine, of course, can disturb sleep. And you don't want that if you're trying to get better sleep. Limit alcohol, sugar, and caffeine at least uh, at least 3 hours before bed. So when we talk about exercise, we'll talk about it more in the next module, but this is important because as Americans, we usually have a very sedentary lifestyle. But exercise will extend the lifespan, and it's recommended that we get 150 minutes of moderate exercise 5 times a week. So, so that's really exercising 5 times a week for 30 minutes a day. Also, drugs and medications can affect our gut health, including proton pump inhibitors, which can cause a dysbiosis and a hypochlorhydria. Uh, Nicotine, caffeine, and sugar and flour also affect our gut health in many different ways. And finally, toxins, which are very difficult to do anything about in our lifestyle that occur in our environment, um, going, uh, from all different areas, such as, pesticides, aluminum, parabens, fluorides, lead, mercury, exhaust and pollution, all different kinds of things that affect our gut health. So it's important to be mindful of trying to reduce this as much as possible, and be aware that that some of these things are present in our world and in our diet and in our homes, and try and do our best to reduce those things. So if you ever wanted to get in touch and work with me, again, I do gut health assessment, recommendations for testing and interpretation, with recommendations for making your gut feel better. I also do coaching on weight management and stress reduction. So if you wanted to get in touch with me, my website is intentionalselfct.com. I'm on Facebook. My page is called Intentional Self, and my Instagram is Dr. Terry Alacio. And just so you remember that this course is for educational purposes only, and it's not a substitute for medical advice. And if you have concerns for your health or wish to be evaluated for any of the issues outlined in the course, please contact a healthcare professional. And I'll see you in lesson 3. Bye.